our health. It's annually celebrated on April 7th since 1950. In order to spread health awareness all over the world. And this year's theme for Health Day, as I mentioned, is our planet, our health, with focus on clean air, water, and food for a healthier tomorrow. In this context, SDPI is holding this webinar with a distinguished panel of speakers that include Dr. Nausheen Hamid, former Parliamentary Secretary for Ministry of Health. Her work in the sector includes raising public awareness for COVID-19, tobacco control, improving health indicators, and achieving Sustainable Development Goal 3, SDG 3, which targets through universal health coverage in Pakistan, children's health, and discourage smoking in children through campaign for tobacco-free kids and owning malnutrition as part of the public agenda. She will join us shortly. Our second panelist is Dr. Rizwan Taj, Dean and Chief Executive, Federal Medical Teaching Institute, PIMS, and is a renowned psychiatrist who is heading the very distinguished institution, Pakistan Institute of Medical Sciences in Islamabad. Dr. Shahzad Ali Khan, Dean and Vice Chancellor of Health Services Academy. He has 28 years of public health related work experience, ranging from peripheral level administration to management of tertiary care health facilities. His professional expertise varies from health system analysis, health management, policy planning, strategic planning, governance, health. Ahmad Khan, Vice Chancellor, University of Agriculture, Faisalabad, is also joining us today. Dr. Iqrar Ahmad Khan is a horticulturist, a botanist by profession. Dr. Khan has a distinguished career spanning over 40 years. His research on wheat, potato, citrus, mango, and dates have benefited the industry and significantly improved the life and livelihood of farmers and rural communities. He's a recognized industry leader within Pakistan and abroad. Dr. Khalid Saeed will also be joining us. He's the Regional Advisor on Mental Health Substance Abuse Program, Department of Non-Communicable Diseases and Mental Health at World Health Organization. And Dr. Razia Safdar, Head CHPI, Center for Health and Policy Innovation, SDPI, will also be joining us. I would request Zahra Khalid to narrate some housekeeping rule before we proceed further. Zahra, if you would please unmute your mic. I think there is some problem with her mic, or she's online now.
Yeah, hi.
Yeah, we can listen. Hear you now.
Can you listen to me now? Hi, hello.
Yes, we can hear you.
Yeah, thank you. Good afternoon. On behalf of SDPI, I welcome you to join this session on World Health Day 2022, Our Planet, Our Health. May I please request our speakers to keep their microphones off when they are not speaking to ensure audio quality for everyone. Speakers are also encouraged to switch on their cameras, especially when they are speaking. Their network allows to do that without any disruptions. The webinar will be recorded and the video will be posted online. You are welcome to revisit the discussion later and feel free to share it with your network. We also invite questions from our audience and colleagues at the end or as the session goes. Please feel free to write them in the chat box or on the question and answers box on the right side. Please have the chat box open in the window as well, or you can also indicate that you want to speak by clicking the raise hands tab on the right side of the chat window. The session will also be telecasted live on SDPI Facebook, Twitter page. For those watching us on Facebook Live, please write your questions in the chat there. They will be forwarded to the speakers through our team. Today's session is moderated by Ms. Ayesha Ilyas. Now I hand over the session to her so we may begin the proceedings. Thank you.
Thank you so much, Zahra. World Health Organization estimates that more than 13 million deaths around the world each year are due to avoidable environmental causes. This includes the climate crisis, which is the single biggest health threat facing humanity. The climate crisis actually is also a health crisis. There's a consensus today that climate impacts different regions differently, and that is essentially related to the unequal distribution of resources. Our present design of the economy leads to inequitable distribution of income, wealth, and power, with too many people still living in poverty and instability. A well-being economy has human well-being, equity, and ecological sustainability as its goal. These goals are translated into long-term investments, well-being budgets, social protection, and legal and fiscal strategies. In absence of a strong health system and economic stability and institutional social protection with equity resulted in individual and family compromise health, nutrition, and mental health issues. Breaking these cycles of destructions for the planet and human health requires legislative action, corporate reform, and individuals to be supported and incentivized to make healthy choices. Dr. Shahzad Ali Khan, we have heard him multiple times in our webinars, and it's always a pleasure having him, for his grip on the subject is rather impeccable. Dr. Shahzad, I want you to share your thoughts on the importance of a well-being economy for general human well-being and sustainability.
Thank you, Ayesha. Zara, and good day, everybody. I think health is now being considered as one of the cross-cutting and multi-system output. It's not just a medical or a clinical thing. Everybody knows that in order to improve the health of the nation, it's not just the health sector which should flourish. So when you talk about climate change, when you talk about this economic development, when you talk about anything which is linked with development, it has some benefits and some losses. Globally, if you see, there are different kinds of experts and scientists and school of thoughts which link the climate catastrophe or environmental degradation to development. Now, there is one school of thought which links this association, that when you are developing, when you are cutting trees, when you are making new apartments and buildings and roads, you are actually degrading the environment. I'll give you just an example that when in our student life, when we used to travel from Rawalpindi to Lahore, on both sides of the train, you will find green, lush green fields and all crops and all farms and very nice scenery. In the last 10 or 15 years, if you see, there is nothing much to see when you are traveling on a rail car from Rawalpindi to Rawalpindi to Lahore, and you will find abandoned industrial wreckages and absolutely unplanned housing schemes and a lot of slums. So there are, to me, when I had just a recap of for today's talk, I started working on the reasons for poor health and health impact of poor environment or health impact of poor planning. We find a lot of factors which actually can lead to such things. For example, it's not the development which causes environmental degradation or health hazards or health impact. It's the unplanned or poorly planned construction, urbanization at a very fast pace without any proper planning and without any creating new cities around the cities. Everybody wants to live inside the city, which is already there. And by hook or by crook, they try to just be into that urban area. And that's how the slums develop. That's how the various societies and colonies develop. When we see this health hazard, it is witnessed that this global climate catastrophe and this environmental degradation because of deforestation and a lot of other, air pollution, water pollution, and many other factors, we have seen a very serious impact on health. I'll not talk about mental health because the guru of mental health is with you. Rizwan Taj will be very elaborate, and I really respect him, and he's a great mental health professional. He will give you an idea of how it has affected mental health. But other than mental health, if you see the noise and the air pollution and the water pollution and congestion, it has led to a lot of communicable as well as non-communicable diseases. So this recent epidemic of COVID, it has given us a new thought that there is something wrong with this environment, and new viruses and new bacteria and new species are coming from either from animals or from an overall environment and shifting into the human beings. It is not just one COVID-19. There are many other resurgences of many other diseases which were once gone. So there are so many epidemics of different types going on around the world. And there are so many health concerns which are growing worse and worse day by day. So for me in Pakistan, if we want to improve this health of the nation through a multi-sectoral linkages, this is the way to go about it. I can see Professor Iqrar Saab here. I can see a lot of other senior professionals who are working in different sectors, but they are talking for health on a World Health Day. So this is a very good sign that for health, it's not the health professional who is to be doing something, and then the others are not responsible. For us in Pakistan, I think we need to think of developing a multi-sectoral forum, and SDPI is one of the very well-suited institute for that. You have a lot of discussions and collaborations going on, and you bring in people, and then many people they contribute. So for Pakistan, first thing which we should do is whenever you talk of environment or health, you should have a diverse portfolio of people, diverse group of people talking for action. So if we want to improve the health system, definitely environment, transportation, industrialization, agriculture, they all have to chip in. There is another thing. We don't need a health policy nowadays. Health is not health sector dependent. So my idea is, and I think SDPI can take lead, my idea is that we should be thinking of developing a healthy public policy. So by healthy public policy, I mean it's not the domain of health department who will be making a policy. Every department, whenever they are working on their policy, they should mention that how this policy can improve the health of the people. Like agriculture, if they are working on an agricultural policy, they should also give a brief overview of how this will improve the health of the people. Definitely good food, good nutrition, nourishment, production, yield, and a lot of other factors which will enhance the agricultural growth and quality. It will definitely improve health. Similarly, transportation, similarly, education, similarly, technology. So I think we should be starting to talk to other sectors. Now is the time to talk to non-health sector, beyond health sector for health, because we have seen putting a lot of investment and a lot of efforts in hospitals hasn't done much improvement in Pakistan, and that is where we are wrong. It is not just the physician or a medical officer or a clinician job to improve the overall health. They can definitely be, they are the one who are there to restore the health of the people, not promote or not protect at large. The promotion and protection is outside the hospital. And similarly, when they send back the person after treatment, for example, Professor Rizwan, when he sends back his patients, there has to be a system in the community and system in the country where the person who has been restored, whose health has been restored by the hospital, has to be maintained. So we need to develop this webinar thing into some good working group or a working committee and start working on various individually. All of us are working in our own sectors, but cross-cutting things, how we can help the agricultural people, how they can help us, how we can help the water and sanitation, how the nutrition people can support us. This is the thing which we need. So there has to be a multi-system platform where experts of different specialties, they sit together and talk for the health of the nation. I think that is why my initial thoughts. And over to you, Ayesha.
Thank you so much. Indeed, I agree. We have environment impact of different projects that you mentioned, and urbanization as well. Inclusion outside that of processed food. On one hand, new neurological innovations, obesity, cancer, and heart diseases, and also contributing to food insecurity challenges. And in a large chunk of population, we are faced with resulting in stunted growth all over. Dr. Iqrar has extensive work on addressing the issue of food insecurity and nutritional from him on the subject. I'd also want him to provide some insight on the use of microbiomes as growth promoters, which are then transmitted to humans due to food antimicrobial resistance in humans. So what is your take on both of Iqrar still with us?
Oh, okay. There was some interruption in your message. Thank you very much for asking me to take the rostrum. First of all, I would like to compliment SDPI for taking the initiative on this special occasion. Looking at today's agenda, the 4-point agenda which has been presented, that is absolutely appropriate, which talks about mental health, talks about the green spaces, taxing processed food, and then reducing food wastage. Before I go any further, I would also like to endorse the views expressed by Dr. Shahzad Khan. He has rightly mentioned that health profession alone, the way we look at it, is not the solution, but there is definitely an important requirement that we integrate different sectors which influence human health. And we tend to use the term now called as One Health. One Health in typical definition means health of animals and humans put together. But I would like to extend it a little further, particularly when it is linked with food and nutrition. Then healthy food, healthy crops, healthy livestock, all that ties into bringing in healthy populations. We know from agricultural background that our water is contaminated, our soils are depleted. We have very clear evidence that most of the soils are saline. Because of salinity, there are micronutrients which are not available to the crops. And then as a result, our food produced as cereals, as fruits, as vegetables is deficient in many essential micronutrients. And those micronutrients are then micronutrient deficiencies are then translated into the consumption, whether that's consumed by the livestock or consumed by the human being directly. One major human health challenge in Pakistan is zinc deficiency. And that is directly correlated with zinc deficiency in the soils. Our soils are all zinc deficient, and as a result, the crops are also zinc deficient. So I'm basically trying to build the argument presented by Dr. Shahzad Khan that we have to work integratively to address the health challenges. Coming to specific 4-item agenda, I would like to mention that we at University of Agriculture, Faisalabad, have assessed the need for psychological support. The climate change is probably accentuating the need. And responding to that, we have established a neurocognitive research and treatment center on campus. In terms of green spaces, we are big proponent of tree plantation. We have been assisting the Prime Minister's Billion Trees Tsunami program, whether that is political or not, but planting trees is absolutely an essential requirement for a better future. And Dr. Shahzad has very rightly mentioned that the scenery along the roadways, railways, along the canals, all present a picture of disappointment. We have cut down the trees, but we have not replaced the trees, and we have not planted new trees. We have opportunity here to arrest desertification, to stabilize our watersheds by planting trees, and then by planting trees, then of course we improve the living environment. So that's not only the case with the big cities, but our overall ecosystem, right from mangroves along the ocean all the way up to pine forests on the highest mountains. The green spaces are being depleted and not being replenished. Taxing the food and food wastage are actually two opposite arguments. Lot of food processing actually is driven by the idea of preventing food wastage. We want to process the food when it is in abundant supply and make it available when there is shortage of food. But then it has industrialized into so many recipes, and your particular mention of high salt, high sugar, high fats. Those are regulatory challenges that can be processed foods with less fat, with less salt, less sugar. This is an idea for product development. This is an idea for the food processing industry. And taxing that and putting it back into R&D might be one option. But at the same time, we know that food wastage is tremendous. In case of cereals in Pakistan, we're facing 15 to 20% clear losses of after harvest, storage losses, transportation losses, pest losses, and then losses even at the kitchen level. And then in case of perishable commodities, milk in particular, and then fruits and vegetables, the losses are up to the tune of 40 to 50%. So while the capacity building, training, investment into infrastructures is one thing, but processing is the other thing that is being offered as an alternative to reduce the losses or to prevent the losses as much as we could. And comparing Pakistan with the developed economies, that's where we are clearly lacking. In developed economies, the losses have been contained by processing. We have moved to higher consumption of processed food, but we have probably much more to do in terms of preventing the food losses. The human health, physical health, mental health, as well as the social behavior, they are all linked with the good nutrition. We have done some work here. I have colleagues sitting in the room right now. We have worked with the school achievements of school kids, and we have found out that most of the kids come without breakfast. So it's not a matter of available food availability, but also habits and the family attitude towards raising the kids. That mothers, instead of giving them a homemade breakfast, they tend to give them processed food, chicken nuggets, and they give them cash. Kids come to school and buy junk food. And before they even go for the junk food time, which is usually break time, by then they have already wasted hours in the classroom with them being able to concentrate on the lessons, because they are hungry while they are not accepting that they're hungry. So food availability on the one hand, and the habits and our shift from a lot of traditional food and the family habits to easy alternatives is also one of the cause of nutritional deficiencies, which are translated into stunting and wasting, into malnutrition reflected in large segment of population. And before I close, I would also like to mention that our resources, land, water, air, are on the one hand polluted and stressed. On the other hand, there is a population growth, which is not letting anything get stabilized. So the bigger health questions remain, but those questions are also to be looked at in the context of population control. To conclude, I would like to say that we need to work more on bringing home the concept of One Health. Thank you. Over to you.
Thank you, sir. I had one more question for you, a supplementary question on the use of microbiomes as growth promoters, which result in antimicrobial resistance in humans. I'd like to hear your take on it.
I have a colleague here who can probably address this question. Imran Arshad is a microbiologist, and he can probably directly answer your question.
Thank you very much for providing me this opportunity. Yes, microbiome, so it's, as you know, so it is changing with the area, I mean the demography, as well as the, you can say the spatial distribution as well. So I mean from area to area, and with our food habits, these microbiome, actually the microbiota, that is the major part of our gut. Actually, the new trends in treatment are we can replace those microbiota and to treat many diseases like the colon cancers, like other diseases which can be cured by replacing the microbiome. On the probiotics, so we can, some of the probiotics, they are in commercial use right now to prevent diarrheal diseases in children. So such are available. But on the other hand, we can also prepare, I mean, the new concept is personalized medicine. I mean, we can give the personalized medicine to treat and check the microbiome of different areas. Like we can have a study of Punjab. We have different food habits in KPK, then Balochistan and Sindh area. So they have the different microbiome depending upon the food habits and the consumption of their area. So environment equally plays a role in this microbiome changing as well, because we are indirectly or directly connected with the this environment, and the sharing of the microbiome between this environment and the human health. So that is directly linked. So antimicrobial resistance, that is your third question. So actually it is a silent pandemic, we could say. So there are more losses due to this, you can say AMR in up to 2050. So they have calculated there are more cases than other infectious diseases. To curb this, you can say this menace of this AMR, we have to shift on the alternatives to the antibiotics. So those can be the bacteriophage therapy, this is one. And secondly, we can move towards the probiotics. So this is all about your questions. Thank you.
Thank you, sir, for your intervention. Can you please introduce yourself for our audience?
Yes, I'm Muhammad Imran Arshad. I'm working as Associate Professor in Institute of Microbiology here in University of Agriculture, Faisalabad. I'm Public Health Microbiologist.
Thank you so much. I'd now move toward Dr. Rizwan Taj, Dean and Chief Executive, Federal Medical and Teaching Institute, PIMS. He's here with us both in his capacity as a psychiatrist and for his expertise in leading a premium medical institute. Dr. Taj, mental health is an often neglected aspect of health that certainly affects the well-being of the society overall. As a psychiatrist in rather developed or metropolitan city, do you think people are realizing about the importance of their mental well-being for their physical health? Additionally, I'd also want to hear from you on the issues of accessibility of healthcare, since as part of management of PIMS, you would have experienced how lack of access to healthcare affects timely interventions for disease control.
Thank you. Thank you very much for inviting me. Mental health is extremely important and crucial for the well-being of the person, and it involves basically he or she leading a normal life, having normal relations being reasonably successful and comfortable in his life. Now, all the parameters, 17 SDGs that you have mentioned, they all affect mental health, starting with poverty, which is a crucial factor for mental health to be affected. And again, then you go on to through the whole list, the climate change and everything. All the parameters are very, very crucial for mental health. Then just to say that we've been really in the thick of the COVID crisis. And with the COVID crisis, we have seen mental health issues in the patients, in the short term, in the long term, and also in the relatives. And especially when there was a large number of deaths, we saw a lot of grief in the families. And so again, as things get more complicated, life gets more complicated, there is migration, there is change in food, everything. All these factors are terribly crucial for maintaining normal mental health. So again, you are right in saying in Pakistan, we are very, very much far behind in meeting our needs for mental health services on one side, creating the number of mental health professionals, and providing the awareness capacity for the general public, which are misled by quacks and non-practitioners. So again, we are lagging behind in that, and we have a lot of work to do. So what we are seeing in terms of mental health, things are much better, say, than 10 years ago, especially after the earthquake, when we saw, which was a natural disaster, we saw a large number of mental health services and awareness come to the surface. And over the years, with the media and with the help of other NGOs and different organizations such as WHO and UNICEF, there has been a great improvement in the understanding and awareness, but we are nowhere near what is needed. And then when you come to services, we are really we have very sorry figures to show. So there's often quoted statement that we need 5,000 psychiatrists and we have 550 or something like that. And in terms of beds as well and everything else. So again, we as health policy experts, and we haven't failed to deliver in terms of the needs of the population in the mental health arena. So again, all these factors directly affect mental health, and the whole range of problems from anxiety, depression to as far as dementia. Our population longevity is increasing, and for the past 5 to 10 years, we are seeing a large number of organic mental illness related to age, such as Alzheimer's and dementia. So we are not prepared for that, and these are complicated illnesses which require a lot of input and support from professionals. But there is no mechanism or system that we are able to provide them the level of service that is provided, say, in the West. So you have all these issues lead to all the range of illnesses from anxiety, depression, phobias, PTSD, psychosomatic disorders, very common in the population of this region, and going on to PTSD. And then we've got the drug abuse and other related illnesses as well. And then it is not just about the mental health. So if you have a bad mental health, it leads to secondary effects on the physical health as well, both communicable and non-communicable. So if you have a mental health issue, you are likely to have secondary effects on your physical health, both, and that again, in terms of its prognosis, in terms of its treatment, in terms of its the cooperation for treatment and seeking treatment, all of these parameters are affected. And then on the social front, the people are unable to lead a normal life. They cannot act in their role that is useful to them in terms of society, in terms of their own homes. So everything that we have spoken about the different climate change and everything else is very, very much linked to mental health, and how much work needs to be done for the increased awareness among the general public and the prevention measures to be put into place. And again, if prevention measures are not, it's gone beyond that stage, then the first stage intervention, early diagnosis, early treatment, early intervention, so that the problem gets not out of hand, leading to serious malfunction in the person's functionality. So again, I cannot emphasize how important all these parameters are, how important it is for us to keep this area of mental health in mind all across the board, for society, for everyone who is dealing with patients, where be it the peers or the Maulvis or the community elders, whoever it is. They need to be appropriately acknowledged and appropriately trained and appropriately educated to be aware and be able to diagnose and be able to understand what mental health effects a person can go through, and what kind of role and what kind of help and what kind of positive advice one can give. So the health system broadly needs to play an important role in identifying possibilities for prevention action that reduce population vulnerability, and in acting to support people whose mental health has been affected. Health systems that meet WHO climate change guidelines and achieve the Millennium Development Goals can do much to limit the health effects of climate change. So a continuation of approaches is being stressed through this forum, depending on the stage of the illness, ranging from prevention through treatment and full recovery. So that is the closing statement that I wish to make. Thank you very much.
Thank you so much, sir. It's rather heartening to hear that there are awareness attempts and increased understanding of mental health issues. But alongside, worrisome as well that we are lacking on systems required to deal with the issue. The fact that we have two speakers on mental health today reflects the urgency we require in action on the subject. Dr. Khalid Saeed is regional advisor to WHO and on mental health. Dr. Khalid, pandemic has rather worsened mental health issues across the globe. There has been direct and secondary trauma that people everywhere have to cope with due to loss of life and livelihood as well. How far do we see the impact of it going in determining our physical well-being, and does it call for an increased attention to mental health from our governments?
Thank you very much. Thank you very much, Ayesha. Can you hear me?
Yes, we can hear you now.
All right. So thank you very much, first of all, for inviting me and sort of highlighting this major public health issue of mental health in relation with the theme of the World Mental Health Day on climate change and our planet. So I think let me just give you a bit of context so that we can understand what we are talking about. So if you look at the last 5 decades, from say 1970 to 2020, climate-related hazards have increased by 50%. And more than 50% of those events have happened since 2003. So it's only in the last about 15 to 20 years that we are seeing this massive increase in both acute hazards like floods, which Pakistan has been experiencing for years now, number of times in the last few years, wildfires, and I'm sure people living in Islamabad are fairly familiar with it. We see that almost every year now. Then, but at the same time, there are slow-moving threats. Like I think the previous speakers were mentioning about food and water insecurity. We know the water tables are going down. We are fully aware that we are no longer able to sustain the food security of our population. We are depending on quite heavily on importing goods for that. But at the same time, there is loss of places which were important for people. And at the same time, which is impacting on the way the culture evolves. See, all these things are interlinked with each other. So they have an impact on development, they have an impact on security, but at the same time, they have an impact on health. And mental health is one of the key components. Now we need to remember that in the last about 25 years, there have been a 50% increase in the rates of mental health problems across the globe. And Pakistan is no exception to that. So at this point, just to put it into quantitatively, more than 1 billion people have mental, neurological, and substance use disorders. 1 in 4 people would have a mental health problem across their life course. 1 in 10 would have a mental health problem at any given time. And at least 1 member of every 4 families would have a mental health problem. And that is, I'm sure, if you look around yourself, everyone would have a story to tell about their family members having a problem. And what is also important to remember is that people with mental health problems tend to die 15 to 20 years earlier than people without mental health problems. And mental health problems are the single largest cause of disability worldwide. More than a quarter of the disabilities globally are because of mental health problems. And also to remember that economically, $1 trillion are lost each year because of common mental health problems. And the projection is that by 2030, that's the Sustainable Development Goals timeline, more than $6 trillion would be lost. But what is being done? Only about 1 to 2% of the budget, health budget, I'm not talking about the overall budget, health budget, which is anyway around 2%, is given to mental health in majority of the countries, particularly low and middle income countries. Rizwan was talking about human resources. The rates are that only 13 per 100,000 health professionals are working in mental health. And this is much lower in countries like Pakistan. In this region, for example, it is 8 per 100,000. Compared to what you would see in European countries where it is more than 50 per 100,000. So what it translates into is that there is a huge treatment gap, that close to 90% of the people who need mental health support do not get it. So that is one thing which we need to remember. And it is particularly true in our part of the world, where, for example, when people are living in developed countries, 1 in 5 would have access to care for depression. But in countries like Pakistan, it is 1 in 27 for very common conditions like depression. But we also need to remember that the effect of climate change on mental health is not uniform. It tends to affect people who are already more vulnerable. The poorer people are much more vulnerable. People who have existing mental health or chronic physical health problems. People in extremes of age, young people, older people, women, for example, are much more vulnerable. Similarly, people who are exposed to political instability, who are already having problems with shelter, for example, who have been displaced, for example, and that is not uncommon in Pakistan. We are seeing that repeatedly in the last few years, that large proportion of populations are being displaced. And to a large extent, we are also seeing this rapid urbanization, which we are seeing, which is breaking up all the social cultural norms and is contributing to this. Similarly, people who are in insecure or informal work environment are much more vulnerable to effects of climate change on their health in general and mental health in particular. So all these, we need to remember that climate change would have impact on the upstream side, that is the determinants of health in general, whether they are social determinants, whether they are economic determinants, whether they are political determinants. All of these are being impacted through this climate change. And it can result in both acute as well as chronic mental health problems. And Rizwan was mentioning some of them. But we also need to remember that in countries like Pakistan, for example, you have fairly high rates of people with malnutrition. meaning case of children. That has an impact on mental health, and it is linked to climate change, which we are experiencing, the emergency which we are experiencing. Similarly, what we see, for example, about lead or mercury in our waters and our soils, leaching of our soils of iodine, which is going to have impact on the neurological development of children and mothers. So all these are direct as well as indirect impact of climate change on that. Now, what can we do? There are 5 things which we need to look at. Number 1, mental health considerations need to be integrated into all national climate change plans, and as well as health policies and programs need to make sure that mental health is part and parcel of these policies. Then there are 3 big global commitments which we need to look at. One is the SDGs, which previous speakers were mentioning, and I think it's important, like Rizwan was, I think, highlighting, that mental health is a cross-cutting issue. It is not only linked to SDGs related directly to climate change, but also issues like poverty, education, women empowerment, supporting, supporting other countries, then around sea and air and qualities and so on. So that is one that we need to remember, that mental health should be remembered when we are talking about SDGs, and our government is committing to that. Second is the Paris Agreement, which was negotiated a few years back on climate change. So it's important that when we are trying to talk about these issues of our commitments to Paris Agreement, we need to make sure that mental health is part of that discussion. And third is the Send-in-Eye framework on disaster reduction, DDR. So that is extremely important to leverage when it comes to making sure that mental health is part of the discussion and is on the table. Then the fourth thing which we need to make sure is that communities are part of this discussion. They are not just passive recipients. We need to engage them, get their feedback as to what is relevant, what is important, what are the sort of resources available in the community, and what kind of cultural as well as social norms they were there, and they can be leveraged to make sure that programs are not imposed on them, but are organically grown from them. And at the same time, that would also mean that the communities would be able to get benefit out of action on climate change rather than opposing it. Because that is, again, one of the things that often we start programs which are imposed from the top without taking communities on board. And we do not realize what are the realities of their existence. Some of them are reliant on wood cutting, for example. Some of them are reliant on fishing. And we are seeing what is happening to the Indus Delta. There is increasing water sea coming in. There is massive erosion of the existing mangrove forest as well as other tree cover. What is happening to the water quality of, and I remember when I was growing up in Islamabad in the 1970s, you would see streams and brooks everywhere. And I remember once catching a fish with my hand in Islamabad, one of these brooks. Now I cannot even imagine. Most of the time, I don't even see any running waters anymore in Islamabad when I come back. So that's again something that we have simply lost touch with what can be done and how we can engage the communities. And then last but not the least is the fact that there are existing huge funding gaps. Just to give you one figure, that at this point, only 0.5% of the international climate change adaptation financing is directed towards health. And you can imagine that what is the proportion of that going to mental health and psychosocial well-being. So just to sort of give the last few sort of one or two take-home messages, that there are clear evidence, and it is growing every day, that climate change and mental health are interlinked, and it's a bi-directional relationship. It's not a one-way relationship. And strengthening the links between mental health and climate change is an opportunity which we cannot miss if we want to have a proper holistic response. And it should become, mental health should be one of the key focal action points when it comes to action on climate change. So I'll stop here, and I'll be happy to sort of answer any questions if need be. Thank you, and over to you.
Thank you. Thank you. You have left us with a very important question, and I'll come to Dr. Rizwan with this later. But first, I want to go to Dr. Iqrar for a very brief answer on this very important aspect of the environmental issues. So a recent discovery of microplastics in human blood indicates how far-ranging are the impacts of our environment on our health. These plastics make way into human bodies through the food we consume. I'd want you to briefly address, has there been any work on solid waste management in rural or agrarian areas from your side?
Thank you very much, Ayesha. Dr. Iqrar is in a meeting, and I am Dr. Masood, but Dean of Food, Nutrition, and Home Science. I just want to respond on the behalf of Dr. Iqrar. Can you hear me?
Sure, sir. Thank you for joining us. Yes, we can hear you. Thank you for joining us.
And you are asking about the food waste. First of all, I would say to you guys that right now about 30% of the food is wasted all over the globe. More or less 1/3 of the food is wasted during production, overproduction, processing, transportation, and something like that. So, I mean, if we can curtail such sort of losses, definitely we can, according to one of the research, it has shown that we can feed about 800 million malnourished population. You are asking very specific about the role of plasters, the plastic bags. Of course, we have to condemn such sort of plastic bags, and we have to come on the food grade system, particularly in the plastic, which is the food grade. And I mean, if we're using the plastic which is not a food grade, definitely it has toxic effect, and some of their monomeric forms are carcinogenic in nature. Right now, the government as well as various organizations, particularly University of Agriculture, Faisalabad, has taken lead, and we do emphasize to use the food grade bags. And in this context, we have introduced one of the bag with the name of Anaj, if I'm not wrong, Anaj, from the agronomy department, and it is hermetically sealed and with a specific fiber which helps to curtail such sort of toxicity. More or less, I just want to share my viewpoint with special reference to the toxic metals, with special reference to arsenic, mercury, and lead, which is also one of the real threats, not in the aqua life, but also, I mean, in the planet. So I would suggest that we have to look on the crop production, especially we can see the raw materials like rice and wheat, because these are the major dietary steppers, to see that how much the heavy metals are present in rice and wheat and other the five main crops. And I just want to share that I have seen that we do one of the research, and it's shown that the arsenic metal is quite heavier at a higher level than in the rice. So I would suggest that we do need a joint venture, and we have a multidisciplinary research to share the ideas as well as to conduct such sort of research with special reference to food packaging also. Thank you.
Thank you, sir. Thank you so much. We'd sure like to explore this further. I have a quick question for Dr. Khalid has left us. Okay. Dr. Rizwan, there is a question for you from Dr. Shaukat Ali, Minister of Climate Change. How can climate change affect our mental health? Does your hospital have climate disaster plan? I think the second question is a more important one because the first one has been addressed already. How does PIMS have a climate disaster plan? Dr. Rizwan, I think your mic is mute. He's probably not able to listen to us anymore, I guess. Well, since we are already over time, I would go to Dr. Razia Safdar for her vote of thanks to our panelists and her closing remarks as well.
Thank you, Ayesha, and thank you, Dr. Rizwan and Dr. Iqrar, for your participation, and Dr. Khalid.
Sorry to interrupt you, ma'am. I think Dr. Rizwan is here now. His mic is on.
Yes, please. What are you asking? Yeah, what was the question you asked?
Yeah, so the question was, does PIMS have a climate disaster plan? The question is coming from Dr. Shaukat Ali, Ministry of Climate Change.
No, we don't. I think that is an important area. I think what you really don't know is that PIMS is going through a transformation into a new system of governance. And certainly, and that's going on for the past 3-4 months. So I'm sure that if you can come up with some recommendation, we can include them in the governance structure that we make. So certainly, I think that you have mentioned a very important point, and we can include that in our future plan of action.
Thank you, sir. With this, I would go back to Dr. Razia Safdar for her closing remarks.
Thank you, Ayesha, for conducting very important and highlighting about the issues which are really important for the planet and ultimately for the health of the people. So the mental health, as we could, thank you very much, Dr. Rizwan Taj and Dr. Khalid. I think he has left already. But these two, the way they have highlighted about the mental health issues, as well as the importance of these in this era of the climate change, that is very important. And I think there are things to do at the policy level and the implementation level. And as Dr. Rizwan Taj has rightly said, that there is no plan, but we wish that it is included in the policy as well as at your institution. And thank you very much, colleagues from Faisalabad Agriculture University, and Dr. Iqrar Khan rightly said about the food chains, and food chain contaminations are they are going to cause more hazards, and it is very important to rightly address them right away. And also the water table contamination, which is the arsenic and lead and all and mercury also. So these are the things which needs to be addressed, and a lot of research. We have the evidence, but still we don't have at a very crisp level of the evidence, and then so that we can incorporate these in the policies. And as Dr. Shahzad said, that we need to have the multi-sectoral policies. Rather having a single health policy, we need to have a healthy life policy. One of the panelists highlighted about the population, which is rightly said that the population is a very important area to think about that. And I will take forward the suggestion of the Dr. Shahzad to build a working group, and it's the time to collaborate and with all the academia, institutions, ministries, and also the international partners to move further on these very important issues of the food safety, population, and the mental health, which are coming in a big way, which are there, and which are now the climate change is there, so we have to deal with these. There are new terminologies coming up like eco anxiety, eco grief, and eco psychology. So these are the things which we need. And Dr. Rizwan Taj has, I think he He was part of many of the working groups as well as the task forces, and I'm sure that at ministry, at policy level also, your contribution will be recognized, and we will be able to deal with the coming challenges. Thank you very much. Thank you, colleagues. Thank you very much from all. Thank you, Ayesha, and all colleagues. And thank you very much, all the participants.
Thank you, Dr. Razia, and thank you everyone for joining us here today. Inshallah, we'll see you again in another event of ours. Allah Hafiz.